Good afternoon, everyone. Welcome to our webinar, How to Develop and Profit from a Culture of Wellness by Kevin Donnelly of Aurora Healthcare. My name is Ryan Kauth, and I will be your host today. I direct the Wisconsin Small Business Development Center, or SBDC, at UW Green Bay. The Wisconsin SBDC at UW Green Bay is part of a statewide network as well as a national America's SBDC network supporting entrepreneurs and business owners through no-cost, confidential business advising and targeted educational programs. Regional SBDC experts facilitate improvement and growth for small and emerging mid-sized companies and help launch successful new enterprises. The no-cost business planning and low-cost leadership development training at the Wisconsin SBDC at UW Green Bay is funded in part through a cooperative agreement with the U.S. Small Business Administration, or SBA. Our website is uwgb.edu/SBDC. Today we continue our 2015 monthly no-cost 30-minute topical webinar series designed for the success of small business owners and their executive team members. At the conclusion of this webinar, we will share the upcoming webinar topics, and we encourage you to consider registering for those. We thank Mickey Noon and Tim Bino from First Business Bank for their partnership in promoting these monthly webinars and for their dedication to small business success. We also thank Michael Wentworth and his company, TMR Associates, the B2B appointment setting company providing qualified leads and market insights, for their partnership in developing these webinars. After the webinar, you will be emailed a link to a recording of this webinar. And during the webinar, you are invited to ask questions at any time. Please use the menu along the right side of your screen indicated here in the red circle. Type your question and hit enter, and as soon as I see it, I will make note of it for the presenter to address toward the end of the webinar. And now I'd like to turn it over to our expert presenter this month, Kevin Donnelly of Aurora Healthcare. Kevin?
Thanks, Ryan. As Ryan mentioned, my name is Kevin Donnelly. I work in employer solutions for Aurora Healthcare. My background is in corporate wellness strategy development and population health analytics. So I do have quite a bit of experience in developing wellness programs for different companies throughout the U.S. We can go to the next slide. We'll get right to the outline here. Today, when I was putting together this presentation, I was trying to figure out how to fit as much information as I could into a 30-minute presentation. So this is the outline for today. We'll give a brief introduction, just making the case for workplace wellness. Then we'll talk about where to start, the 7 benchmarks of wellness, and we'll get into detail what those are. Then we'll get into the meat and potatoes of the whole presentation, talking about wellness for a small business strategy and what types of data you should collect when developing a wellness program, and then where to go from here. Some different resources for you to take home and work with when you're developing your wellness program. So if we look at the United States as a whole, the state of Wisconsin isn't quite as bad when we look at the obesity epidemic, but we are definitely getting worse and worse as the years progress. In the U.S., 35% of the adult population is considered to be obese. In Wisconsin, right now, in 2013, we're right at about 30% of the population is considered to be obese, but when you compare that back to 2004 and 1990, it's almost a double-digit increase there. So things are definitely getting worse. Right now, we're the 22nd fattest state in the United States. What does that mean to businesses? If we look at the top 10 modifiable risk factors, what these are, when we look at what a company spends on their health care, there are modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors are things like genetics that people just can't control. The modifiable risk factors are lifestyle activities that people can control, but they directly impact a company's bottom line when it comes to healthcare. I do have 10 of them up here, but I do want to focus on the first 3, obesity, physical inactivity, and depression. These are the top 3 modifiable risk factors that companies spend on healthcare per person annually. The dollar amounts are right there. Obesity is the top at $347 per person per year. Physical inactivity, $178.6 per person per year, and then mental health or depression, $128.2 per person per year. So when you're developing your wellness program, if you don't focus on anything, definitely try to focus on physical activity and mental health. If we look at how an individual spends their time during the day, and we break it down to the activities that they do during the day, the majority of the time is either spent sleeping or at work. So it makes sense if we're going to try to change an individual's behavior or help them make a change in one of those modifiable risk factors, we try to make that change at the place they're spending the majority of the time, and that is at work, so in the workplace. Now when you get the slide deck, there will be some hyperlinks. We're not going to click on them right now, but I do encourage you to click on those hyperlinks, and this is one of those. The 7 benchmarks of wellness from the Wellness Council of America. A lot of the material in this presentation today comes from the Wellness Council of America. What it is, it's a resource for employers. It's considered the governing body of workplace wellness programs, and there's an abundance of free resources on there. One of them is this best practices in developing a wellness program, and when you're developing a wellness program, you want to follow what they call the 7 C's. The first C is capturing senior level support. So without having that senior level support, the C-suite or upper management support, the chances that a program will be successful are slim to none. You really need to have that executive level buy-in in order to make your employees realize that it's a priority for the company. The next step is creating a cohesive wellness team, and that wellness team should be made up of individuals representative of your entire population, not just people in administration. You want this wellness team to be people who do work on the floor. A lot of times it's an HR person's on the wellness team. If you have a safety team, a safety manager, and then the people that are actually doing the day-to-day work of your business so that they have some buy-in and some say in what types of activities and programs are actually taking place in your wellness. The next step would be collecting data. Without data collection or having some idea as to what risks your company has or what the highest spend of your healthcare is, you're just throwing darts at a wall and trying to figure out what sticks. You really need to have data in order to do the next C, which is crafting an operating plan. Using that data to really drive that wellness strategy and making sure that that operating plan is focused on the risks that are going to make the biggest impact in your population. And then choosing the appropriate interventions, creating a supportive environment, and then carefully evaluating outcomes. If you click on this link once, you get the slide deck. It'll give you a little bit more description, but for the sake of time, we'll kind of move on here to the next slide. I do want to give you the website, though. It is www.wellcoa.org. You'll get that in the slide deck. The 7 benchmarks of wellness typically work best with larger companies. They can be extrapolated out into smaller businesses. We do know that 99.7% of all businesses in the U.S. are small businesses, and small businesses employ about 50% of the workforce. You can still have a successful wellness program. The approach is similar, but just a little bit different. So we'll kind of focus on that in the next couple slides here. Step number 1, basically there are 10 steps for small businesses when developing a wellness program. We're going to focus on the first 5 or 6 because they're what I believe to be the most important. Step 1 is very similar, exactly the same as the 7 benchmarks. You must have CEO leadership buy-in. It lets employees know that the wellness program is a priority, and when I'm working with businesses, I always encourage the business owner or someone from leadership to issue a formal letter of support to employees, letting them know that, hey, we are going to be starting this wellness program. I am in support of it. It really just helps the employees know that there's support from the top, and it sets the tone for the entire program. One of the hardest sells you might have is to make the business case to your CEO or leadership that wellness is important. So when you're making that business case, you can let them know that research has shown that for every dollar a company spends on wellness, you can expect to see a $2 to $3 return on investment within 3 to 5 years. If you still have a hard time selling your leadership on a wellness program, it doesn't hurt, and I encourage other companies to do this, to connect your leader with other company leaders who do have wellness programs and support wellness programs. And you can do this through your Chamber of Commerce activities, things of that, just identifying leaders in your area who support wellness programs and connecting your leadership with it to make sure that you're really getting that senior level buy-in. The next step is a little bit different than the 7 benchmarks. Instead of developing a cohesive wellness team right off the bat, you're going to want to designate a wellness leader. And this is going to be an individual at your company that you identify. Part of their job duty is going to be driving that wellness strategy and coordinating the wellness events that take place on your site. Typically, it's someone within HR benefits, and they help to coordinate the programming and screenings that you're going to have on site. You really need to have that wellness champion or wellness leader to drive that strategy and coordinate all the activities that are going to be going on your work site. Step number 3 would be to gauge employee interest. This is part of the data collection process. A lot of times we think we know what our employees want. We think we know the types of activities that our employees like, but we really don't know until we actually ask them. So in blue here, there's a link once you get the web deck. I do encourage you to click on it. It's a free interest survey off the Wakulla website. You can literally just print it off and distribute it amongst your employees. And then once you get the results back of those interest surveys, develop a report. It doesn't have to be a lengthy report. It can just be in Excel. But you want to communicate those results back to the employee population. Again, this helps solidify that this is a priority with your company, but it also helps them feel engaged in the wellness program. The next part of data collection would be to provide your employees an opportunity to know their numbers. A lot of times, employees don't go to their yearly physical exams. They don't know what their health status is. If you look at the graphs on here, and this is from real data, an individual's perceived health status is oftentimes a lot different than what their actual health status is. And we want to increase that awareness of our actual health status so we can help our employees make decisions about their health and lifestyle before their health status becomes some sort of catastrophic health event. The majority of people who are in the low risk or excellent or good health category typically know that they are. It's when you get into the people that think they're in a moderate risk or fair health category, and about half of those people are actually in a high-risk category for some sort of catastrophic health event to occur, and that is going to end up being real dollars to the companies. So you really want to provide an opportunity for your employees to know their numbers, and this would be through a biometric screening. You can either have it done on-site, or you could set up a program with your local health system or wellness vendor where your employees can go and get their health screening done. The most important numbers to look at when you're doing a health screening would be BMI, or body mass index, to understand what their body fat percentage is. There's a lot of health risks associated specifically to weight alone, what their blood sugar is, so you can get a diabetes risk, cholesterol, and blood pressure. These are the 4 main measurements that you're going to want to look at when you're looking at a health risk or health awareness program. If you don't look at anything else, focus on these 4. If you're not going to do step 4, you're just looking for a place to start, your best bet is going to be to focus on physical activity. Implementing an annual physical activity campaign in your company will provide real dollar savings on your healthcare costs if you can get people to participate in it. Because when we look at physical activity is going to have an effect on an individual's risk for developing diabetes, an individual's risk for developing high blood pressure or cardiovascular disease, also some forms of cancer, and increased physical activity has also been shown to decrease stress or anxiety in an individual. So just focusing on physical activity alone is going to help you alleviate some of the most expensive risks that you'll see. Many healthcare providers or many wellness companies do have prepackaged campaigns that you can just plug and play with your company. We at Aurora Healthcare have these types of programs that we can just provide. I know our competitors do as well. Even if you go onto the Wellcoa website after this webinar, once you get the slide deck and have the link, there are plenty of different ideas and plans for physical activity campaigns that you can just implement right in your workplace. In order to get the most engagement out of your employees or most participation for these campaigns, you do need to provide some sort of incentive to participate. This incentive doesn't always have to be huge, but it does help in participation. Some ideas of incentives that companies have used in the past: gift certificates, just to movies, restaurants. One big one that we see a lot of companies use are chamber bucks because they can be used anywhere. Some companies even offer additional paid time off. So for the winners of the campaign, or for the people that complete whatever physical activity campaign it is that you're doing, they get an additional hour paid time off. Money, never underestimate the value of the dollar. Offering money for participation. And then some companies also offer a Fitbit or something similar, like an iPad or an iPod, for these physical activity campaigns. One real easy physical activity campaign that you could implement at your company would just be an 8-week walking challenge. The goal is to get 10,000 steps a day. Most people have smartphones, and there are apps on smartphones that track steps. Pedometers are very cheap and very inexpensive, and just have individuals track their steps each day. 10,000 steps equals about 5 miles. So if you wanted to take it a step further and say you wanted them to walk from Miller Park to another ballpark, or try to hit all the ballparks, you could have one step equal a certain number of miles. And then for everybody that completes the 10,000 steps in a day for the 8 weeks, their name gets thrown in a hat, and they get their name pulled out of that hat and for a chance to win one of the incentives or larger incentives. So that's just one idea for a physical activity campaign. Step number 6, to really drive home that this is a priority with your company and really try to drive home the fact that you're trying to develop a culture of wellness within your campus, you need to implement some healthy policies in your workplace. Some examples of healthy policies: one of them would be making your campus a tobacco-free campus or workplace. No tobacco on site whatsoever, not even in the parking lot. This does make a huge impact. We had this at the last company I worked at. We implemented it, and it did cause some people to actually quit using tobacco because they were sick of having to walk all the way across the street in order to have that cigarette, and they didn't have a lot of time. So with that tobacco-free campus or workplace, it never hurts to offer some sort of tobacco cessation program or class. And if you speak with your health systems, your local health systems, they do have those available for employers. If you have drivers, implementing a mandatory seatbelt policy. If you do have drivers, this is already a Department of Transportation mandate, but making it a zero-tolerance policy. Also zero-tolerance drug or alcohol policies as well. It's always a good idea, if you do have an EAP or an employee assistance program, to hook up that zero-tolerance policy with EAP, so you're not just firing an individual for having drug or alcohol at work. You're providing them an alternative opportunity where they can either leave work and be done, or they could end up being referred into your EAP program and really working with a counselor to make a change and get at the root of the problem and hopefully alleviate that drug or alcohol issue. So this is all great, but how are we supposed to pay for it? It sounds expensive, but it really isn't, and I'm going to go through some data next to help you understand how you can pay for implementing a wellness program on your workplace. As I stated before, return on investment, oftentimes your return on investment will be enough to offset the cost of a wellness program. Recent evidence suggests that for every dollar you spend, you can expect to see a $2 to $3 return on investment. Typically it takes 2 to 3 years. It can take up to 5 years to see that return on investment, but if you implement your program well and you follow the 5 steps or 6 steps that I outlined, you will find that return on investment. Some other considerations, Through the Affordable Care Act, we are now able to offer premium incentives, health insurance premium incentives. We actually do this here at Aurora Healthcare. If you participate in the wellness program, you will pay less for health insurance. If you don't participate, you will pay more. And the people that pay more, the amount of money that we collect offsets the cost of implementing our wellness program. So the Affordable Care Act gives us two options. We can either have a participatory-based wellness program, meaning that if our employees participate in the wellness program and nothing else, they'll receive the incentive, or we can have an outcomes-based wellness program, meaning that you do your health risk assessment and biometric screening, and based on the numbers that they get, if they're in a certain health category, they will get the insurance premium. There are some more stringent restrictions with an outcomes-based wellness program. The insurance premium differential can't be more than 30%. It can be up to 50% if linked to tobacco use, but I do urge you to speak with your broker or legal representative about all the regulations involved to make sure you're within the bounds of the Affordable Care Act. We are actually on April 30th here in Sheboygan having a wellness conference that's free of charge for employers, and one of the topics that we'll be covering is the legal ramifications of a wellness program. We'll kind of be diving into a little bit more of this. My contact information is on this slide deck, so if you're interested in attending, get a hold of me and I can get you registered. Some other resources to consider, looking for free opportunities that support your initiatives. Plenty of health systems have community education events or provide some wellness services for free. I know we at Aurora Healthcare do for many employers. For small businesses that can't support having a lunch and learn on site or some programming on site, a lot of them will send their employees or make their employees aware of community education events that we have. And we do offer resilience training for the community, healthy cooking demonstrations throughout the community that are available to the public free of charge. And if you click on the link, once you get the slide deck, it'll bring you to our community events page where everything's listed. Get to know your local health systems. It doesn't matter if it is Aurora. Ideally, I would love it to be Aurora, but getting to know your local health systems, they can always offer support in you getting your wellness program going. We have doctors available that can come out and give presentations. We have nutritionists just itching to get out and give presentations. So definitely get to know your health systems. And then also look to your local public health department. These links here are just to the 4 in my area: Sheboygan County, Manitowoc County, Outagamie County, and Fond du Lac County. But all of these public health departments have committees that are focused on physical activity and wellness within employer groups. And a lot of the services and events that they provide are free of charge. So if you click on these links, it'll bring you to their events pages. And these are excellent opportunities for your employees to be able to participate in some sort of wellness event without you having to pay for it or bring it on site. Another opportunity is through local legislation in the state of Wisconsin, Wisconsin Act 137. If you click on the link, it's a small business and wellness grant. This is available to small businesses, so you do have to have 50 employees or less. And what it does, it covers 30% of the cost of your wellness program. So we're developing your wellness program that not to exceed $3 million. This is a one-time grant, so make sure that you're going to apply for it in the most expensive year. Right now, it is a pilot grant program, so it will run through 2018. After 2018, they're going to see how it goes and potentially extend it out even further and make some modifications. But right now, this is a great opportunity for small businesses to get some financial assistance in developing a wellness program. Piggybacking off of that, in order to qualify for the grant, there are some regulations. Your wellness program must include a health risk assessment. So that would be, the health risk questionnaire and a biometric screening, and one of the following programs or services: either a chronic disease prevention program, a weight management program, a stress management program, worker injury prevention programs, health screenings, nutrition education, health or fitness incentive programs, vaccinations, or employee physical examinations. If you think back to the 2 slides ago where I mentioned, the health systems do provide a lot of these community education programs for free, and they are focused a lot on weight management and stress management and nutrition, some of these may qualify as the additional programming that you offer for your employees. So definitely something worth looking into. So in review, looking back at how to develop a wellness program, your first step should be getting senior level buy-in or support. Without that, you're not going to have as successful a program as you could potentially have. Having that senior level buy-in definitely does help drive wellness strategy. The next step would be developing a wellness team or appointing a wellness leader, a point person that can take the wellness initiative and run with it. You want this to be someone who does have some influence among the employees. You want it to be representative of your employee population, so someone who is their peers that can really be a cheerleader for the program. The next step would be collecting data either through an interest survey, screenings, or both, so you understand what risks you are seeing in your population to help you make decisions on what types of programs you should use or provide. And then if you're not going to do anything else, focus on physical activity. And last but not least, access local resources. It does seem like a lot to have to put together a wellness program on your own. And we here at Aurora partner with businesses to help them really develop that wellness strategy, understand what types of information they need in order to make that wellness strategy successful, and really kind of hold your hand and consult with you on making sure that what you are implementing does work and it does become a success. So thank you for your time, and I don't know if we have any questions, Ryan. I'd be happy to answer them now.
Thank you so much, Kevin. Great presentation. The one question that has come through is, and I think I know the answer, but I'm going to let you give your input on it. You're the expert. If you don't get senior level or business owner buy-in, what can you do, or what have you seen other companies do to, try a grassroots effort or catch fire throughout the company?
If you don't get that senior level buy-in, and you still want to somehow develop a wellness program and maybe get that buy-in through a grassroots effort, you can definitely just do one of those physical activity campaigns that's found on the Wacola website, either a walking challenge, just getting a wellness committee together and figuring out what type of activity program you want to do. It could be a Biggest Loser program where it's completely grassroots, and just make sure it's successful on your own, and that'll really show leadership that this is something that you're interested in, your employees are interested in, and more than likely they will buy into it. And I also urge you to connect with a wellness professional in your area to kind of help develop those programs as well. And my contact information is on there. I'm more than happy to help you get that off the ground and help you get that senior level support.
Great. Kevin, thank you so much. Really appreciate the information you shared, all the resources, especially the free ones that are available to really everyone. And again, thank you so much for sharing your expertise today.
Thank you.
Our webinar next month features Spence Smith of Spencer X Smith Consulting. He will present how to establish yourself as an expert. In June, Carrie Chochette of Purple Squirrel Advisors will present how to hire leaders who have it all. In July, we'll learn how to focus on your customers to grow your business. And in August, secrets to successful and simple employee development. September, how to manage your banking relationship and not be managed by it. And in October, how your workflow improves your bottom line. And then to wrap up the year in November, we'll learn how to harvest maximum value from your business. And December, how to use benchmarking to increase your business value. You can register for our on-site workshops, virtual certificate programs, and all upcoming no-cost webinars at uwgb.edu/SBDC. We also have several past webinar recordings there on sales, marketing, business ownership, and leadership. In closing, I would very much like to thank Kevin Donnelly of Aurora Healthcare. Thank you, Kevin. Mickey and Tim at First Business Bank, and Michael Wentworth of TMR Associates. And thank you all for attending. Now, go develop a culture of wellness. This concludes our webinar. Goodbye.